So, Darwin, I hear that every day across the United States, 10,000 people become Medicare eligible. What does that mean for advocates?
Yeah, that's a good question. And it's amazing to think that many people literally turn 65 every day. And in most cases, they've got Medicare eligibility. So they are now finally entitled to Medicare. And that means that they've got decisions that they need to make. And those are time sensitive decisions because there's a window of 90 days before 3 months before their birthday, the month of their birth, and then 3 months following the month of their birth. So they have a window and they have earned these benefits. So they are deserving of the benefits. And I would encourage them to call a local agent, hopefully an advocate agent, but in any case, get some advice in making those decisions because the plan that you choose really has a big impact on your overall health and wellness. And that could be just the financing of the plan, but you really need to have a goodness of fit. That includes the physician that you choose, the hospital that you choose, and the plan benefit. So a lot of these plans not only are designed to leverage preventative services and checks in advance, they also help you keep your wellness by doing other things besides getting sick, like gym memberships and cessation, weight loss programs, smoking cessation programs, because really when it comes down to it, they know that an ounce of prevention beats a pound of cure.
You would say that those turning 65 should turn to advocates because they're Medicare experts. Is that right?
Yes, an advocate specializes in the turning 65 community. You know, if you've been on Medicare Advantage for a while and you are used to the plans and your needs change or the plan's benefits change every year, county by county as they do, then you have some comfort and familiarity. But the people that are turning 65 for the first time have a very unique set of decisions and they need education on Medicare, on original Medicare, on Medicare supplements or Medigap policies, or Medicare Advantage, which is also called Medicare Part C, which is actually not a part, it's the whole thing where you get all of your benefits through a private company. And the private companies really, they do better at customer satisfaction. They offer you more choices. I mean, think about it. Your shoes come in half sizes for a reason because everybody likes a good fit. You need lots of different choices because everybody's different. And so you really want to optimize that goodness of fit. And our agents are experts for you as a turning 65 candidate for Medicare to be able to make that match.
Going through these tough times, so many companies are laying off employees. People are out of work and also have lost their health insurance. What can you say about how advocates can help in these times or what it's going to look like for the uninsured in the country?
Yeah, well, these are challenging times, but the truth is that people and layoffs have occurred long before this virus came, and they will be happening during and after. And while companies and the government are doing a lot to protect and help people and get them through these tough times, it's still really complicated when you leave a company benefits package and you're in the Medicare eligibility period. And outside of the other options of insurance that you might have, if you're in the unique situation where you have been working, perhaps you're 65 and you continue to work, perhaps you got part of your Medicare benefits, but not all of your Medicare benefits, there's a lot of confusion about when to get what part of Medicare, how that works with your company, how your company will treat that. So our agents are actually in a really good position to help you understand that. We'll work with your employer group benefits people because each company is different and we wouldn't want to harm your position, right? So you may or may not be able to go back to what you have with the company. But if you find yourself where you're not with the company anymore and COBRA is really expensive and about to run out, call one of our advocate agents. Somebody in your local community as a resident expert can come out and help you look at Medicare and the associated decisions that you need to make around it.